Here. Hi, how are you doing?
If you have chronic lower back pain or leg numbness or weakness, it could be a sign of a herniated disc, something that's very common.
A herniated disc occurs when the cushion bulges out of its normal confines within that space.
In the past, a herniated disc could mean major surgery that would force patients to take significant time off to recover.
It stopped me from being able to sleep at times. It's made it difficult to walk. It's made it very difficult to sit at times.
Right. Now, a new procedure called hydrodiscectomy could bring an end to all of that. It's a minimally invasive outpatient procedure using a local anesthetic that allows patients to sit up right from the operating table and go home just hours afterwards.
Hydrodiscectomy is a very ingenious, very new technique to remove a herniated disc. This is the hydrodiscectomy equipment. If you look closely, there's a gap at the bottom. This end plate protects the nerves and any vital structures so we don't do any damage. And then there's a strong jet of water that shoots out through that gap. And we're going to step on the button now, and maybe you can catch it. It's a very fine jet of water, but it's very powerful. So the disc gets sucked into this cleft, and then it's blasted by the jet of water, and it turns the disc to liquid, and then this other tube sucks the disc out. So we can actually sculpt inside the disc in a matter of 5 or 10 minutes and totally decompress the disc protrusion.
This new procedure is also less traumatic than conventional disc surgery.
The disc removal is very quick, so that means there's less anesthetic time, there's less time on the operating table, and patients like to get off the operating table quickly.
After years and years of back pain and surgeries and epidurals and pain pills, and I was at my wit's end, and my HMO that I belonged to said I needed 3 fusions, and they couldn't do 3 fusions. It was impossible.
Hydrodiscectomy patients typically have less pain and faster recovery time than patients having conventional disc surgery.
I think it's a lot less trauma to the body, a lot less trauma to the muscles. You can heal faster, and I've just seen a lot of the doctor's patients and talked to them after his procedures, and it's just almost practically miraculous how fast they heal. And they were just like me, had gone to their wits' end from doctor to doctor, from surgery to surgery, from epidural to epidural, and it's just incredible, the healing that takes place so fast.
Show up in the morning, have the procedure done, and you leave the same day in your vehicle and have someone drive you home. Basically, there's very little pain or discomfort. You're provided with pain medication and muscle relaxants, which I took very few of, and you carry on with your normal life. You can stand as long as you want. You can walk as long as you want. You can sleep without a back brace on and be very comfortable. And from the first night I had the surgery, I never experienced any pain in my back, legs, or anywhere else while trying to sleep. Pain involved is so minimal that I would just tell someone you wouldn't even be concerned or shouldn't be concerned with what the procedure is going to cause you as far as pain. And it's a less invasive procedure, and it's the way to go.
Mark?
Yeah.
That pain that you had in your leg?
Yeah.
Does it feel any different?
No pain.
Feels okay now?
Yeah.
Good.
Most people will experience back pain at some point in their lives, but if surgery is needed, it may not keep us off our feet as long as it used to.
Mark had surgery when?
Yesterday.
Oh, yesterday?
At 9:30, yes.
At 9:30. And how is your leg pain?
I have no leg pain.
Okay. And how is your back pain? If it was a 10 before, where is it today?
Maybe a 2.
A 2.
There's
okay.
some little discomfort, but
okay.
It's very manageable.
And we just took photos of your back as well, and
Correct.
The incisions are almost healed.
Oh, that's outstanding.
Okay, good.